Alrighty. Here we go. Good morning, good afternoon, good evening. Welcome down the security rabbit hole to another edition of the Down the Security Rabbit Hole podcast. I am your host with
The most.
some, the most. I hate saying the most because the most what? Um, the most Bears jerseys. The most TVs. I don't know. Anyway, that did not work as a new intro. We'll try that again at some point next episode. Jim, how are you, buddy?
I'm doing good, Raph. Doing good. I am the I guess the host with the lesser.
Nah, that's false. You're the host with the most books written
Yeah,
and
well,
experience.
I don't know. This means
So
I'm old.
you know how you know how we can tell it's autumn when we're recording this. I'm wearing a Bears jersey and you're wearing a flannel shirt.
That's it.
So
it got cold quick. So
it got cold quick. Yeah. The South has gotten cold and got cold quick. All right. So that's a great segue into healthcare. I don't know how, but it is. Trust me on this one. To which we bring Sir John Kuhn. John, how you doing, man?
Great. Can't complain, Raf. Thanks for having me on. Jim, good to connect. I'm super
Yeah.
excited to talk about healthcare and privacy and security today.
Yeah, guys, as you know, we've been trending over the last year and change consciously to kind of talk less about like hacks and incidents and vulns and all the traditional security stuff, and really cover the topics that, as a security professional, I wish somebody had pointed me towards. The healthcare industry is a challenging environment, if I use my words correctly. John, tell us who you are and what you do, and then I'm going to dive us in.
Yeah, absolutely. So who I am. So yeah, I'm John Kuhn. I'm one of the co-founders of a company called Integral. And what we help with is anonymizing healthcare data. And so before that, my background has been in software engineering, having worked at Salesforce on their file ingest team for their enterprise customers, including JCPenney's and others. And then, before Integral, I was at an early stage startup called Oliver Space, where I was working on their backend systems. And so, but healthcare data, the regulatory frameworks around it are very complex. And so Integral is helping with the anonymization, data pipeline, and delivery. And so we can get into any and all of that.
Yeah, listen, healthcare is interesting for me because I've got a lot of some firsthand, but a lot of near-hand experience. So my cat has decided she's joining the podcast today.
Hey,
so
cat.
This is Lucky.
Perfect.
And Lucky, say hi. No, all right. I think this is what she wants. She wanted the tail wag right in the middle of my conversation. But healthcare has been an interesting spot for me because I've been in and around it for a bit, and sold into it as a vendor. Have family members that worked in it. And the thing that I've noticed about healthcare is it's usually a little bit behind the rest of technology by 7-ish years in terms of adoption in terms of the last place you would ever find a Windows XP box, if it would be in a hospital, which terrifies the hell out of me. But you're this is great because we tried to find like, hey, what's the topic we want to cover? And healthcare was like, yes, healthcare is a mess. What about healthcare? You said privacy, kind of a data anonymization, and then you mentioned AI, and I had to take a drink. But where are we in terms of privacy or privacy, if you're British, when it comes to healthcare? Because last I checked, everybody's stuff has been everywhere, and nobody, it's not really there's no secrets anymore in healthcare, and that's scary.
Yeah, no, 100%. And yeah, you're right. It's scary because it's more sensitive than other data that might be leaked. With your bank accounts or your credit card information, you can just sort of flip a switch and turn off your credit cards. But with your private, sensitive healthcare data, it's not great if people know your diagnostic conditions or if you've had breast cancer or something more sensitive even, right? And so that's very personal information. And then it also comes with civil penalties that are a lot higher. And so, yeah, and I think, Raf, you touched on a point, which is that the healthcare industry is a little bit more dogmatic and slow to adopt change. And I think part of that is that we're so afraid to touch any landmines as we transition to something new. It's like once something works and is vetted and passes security frameworks and compliance checks, no one wants to touch it, right? No one wants to untangle that. And so, there's a lot of doctors' offices, hospitals that are running EHR software from the early 2000s, like you mentioned. And so Oracle and Epic systems are not the most intuitive or user-friendly. But then we've also got all these nurses and doctors who've gotten used to working with it. And so there's also a social element too, which is if you want to adopt new technology, you have to coerce everybody to retrain all their practices and input new billing procedures into the new software and everything else. And so it is a slower sector to adopt change.
That's the thing that that's always been interesting to me is in a lot of other industries, technology is a enabler to make more money, service more customers and all that. While obviously that's true in healthcare, right? Better technology saves more lives. A lot of healthcare is about speed and access to data. And a lot of what we do in security is slow things down and remove access to data, which makes these two worlds clash really hard. And that's been a challenge since the late 90s from personal experience.
Yeah, I mean, there's going to be a natural push and pull, right? So you can't have all your toys all the time without some sort of constraints that make sure that the people that are acting on the data are the right people. To take a step back a little bit, there's fully identified data that your doctor has access to. Your doctor should have your medical history, right? And that is sensitive information. And your doctor is entering into a contract with you to, not speak about your diagnostic conditions with other people. And so they have a right to have that information and to store it on hand for auditability, logs, traceability. And then and we'll maybe talk about this a little later, if you want to move that to where they're doing public research on outcomes, or if people are looking to buy that data or buy claims data, that is a different segment, which is the de-identified space, right? And so there's totally proper uses of healthcare data in its fully identified form, and that has to come with its own constraints. And then with the de-identified landscape, that's where people are trying to activate and pull insights from that data. It has to go through this anonymization step. And that's where things get a little bit more flexible, but the fidelity of data has changed, right? Because you don't have all the information. And so it's always going to be a little bit of push and pull. And that's sort of like where Integral helps, right? It's sort of like dialing those and tuning those knobs such that this tug and pull is kind of fine-tuned for a given use case. And what's the risk profile that the organization is willing to take on? Because there's no one size fits all for this.
Well, I was just going to say, first of all, I just want to put a shout out to those working in IT and healthcare, because look, I'm going to tell you, that is that's like IT Zilla hard. You know what I mean? You have old systems, new systems, things are spread all over the place. You got equipment that most organizations have to deal with, and it's all breaking and it's doing crazy stuff. So first of all, shout out to those folks. And of course the security people that work in those organizations, shout out. I wanted to ask you kind of a two-part question, if I may, is
sure.
When it comes to the anonymization or tokenization, or however your technology is doing it, I'm curious has that been something that's a strategy that's been in place for a while in the healthcare industry and working with research organizations and CROs or whatever you want to call them? And then when you look at doing it, all I see in my mind is this hugely complex, flat environment with databases and applications everywhere, right? And I'm trying to think, how are you going to anonymize something? Because I can see stitching it together in different ways for the doctor, right? But that doesn't necessarily mean that, how you package that information up and then move it through some sort of anonymizing capability. I'm just really fascinated to hear the fundamentals of what that looks like architecturally.
Yeah, absolutely. And I think this question gets to the heart of a lot of the recent developments over the last decade in sort of like data linkability, especially in the de-identified context. And so, yeah, to your point, the IT admins that are working in the healthcare setting have, some of the most complex workflows that I've ever seen. They're dealing with on-prem software. They're dealing with air-gapped environments, so no open internet access, and just like much more rigid security postures than, a traditional SaaS startup might have to deal with, right? And so that's never mind all the procurement that has to happen. If you want like a shiny new tool, it probably won't happen because it has to go through, 2.5 years of procurement. And so you asked me about sort of the here to there on the anonymization steps. I think traditionally, if you had data that was going to be activated for research, the easy part is just removing patient names and other identifiers. And so if you go to HHS's website, there's got a list of all the different identifiers, and those things are your email address, your social security number, first name, last name, that kind of stuff. And so that's easy to do. I think you started to touch on the more difficult part of the usability of data, which is joining it all together, right? And so if you imagine hospital system A has data on patients and then hospital system B has data on patients, how do you get them to talk to each other while preserving patient privacy? That's really the challenge. And so one of the biggest advancements over the last decade to enable that sort of interoperability or at least joinability of data is tokenization technology, like you mentioned. And so for your viewers, tokenization is just a fancy way of saying, I'm going to take a patient's name and other identifiers, and instead of just removing them outright so that they're missing from that data, I'm going to hash them, right? And so there's also a salt string, and we can get into the cryptographic nature of it. But ultimately, Jim or Raf becomes like a hash, like some alphanumeric string. And then if two different hospital systems tokenize, the same patient will have the same token. And then you have this linkable pseudo-anonymous identifier that becomes this join key for which you can join a bunch of different data sets together. And so that has just opened the floodgates on a lot of different healthcare data activation. So clinical research teams are buying data. And so now it's just sort of like, no holds bar. A lot of different pharmaceutical companies are just spending tens of millions of dollars a year on all these different tokenized data sets and trying to join them together. And then this also introduces a new concept, which is the sort of, now I'm forgetting what it's called, but like the history of your care, right? So for the last like 14 years, can you see the entire patient history? Can you join it against transaction data at Whole Foods, so you can understand like a holistic patient profile rather than just like a small little aperture, which is, encounters at the hospital.
Wait, hold on. Pause. Time out. Time.
Hold on.
Wait,
Flag
hold
on the
the
field.
phone. Wait. Ding, 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 ding.
Wait a minute. You just jumped like Megalodon there. Go back about 15 seconds. You just said joined your healthcare profile with your profile, like what you buy and eat. What?
Yeah. I mean, a lot of different payers are asking for this information to have more accurate underwriting models for, setting policies. But it's also true for people that are trying to do research or outcomes prediction for therapeutics or different drugs. If you go to the store, if you have, your Sabre card that you scan, all that is being tied to some account that ultimately gets commercialized. And it's the same thing with purchase activity online. And so we can go into that as well. But yeah, your consumer data, ad distributions, everybody's working really, really hard to join that to
I did not know that. Did you know that?
I didn't know it went that far. I'll be honest with you. We all know that they're kind of connecting dots in different areas of our lives, but I always felt that the healthcare side was somewhat separated. And I understand insurance companies and actuarial science, if you will, like a better term, and to be able to better understand treatments. I think there's a good social meaning there, but with great power comes great responsibility kind of thing. And I did not make that connection. No, I did not know that, Raf. Nope, John. Now I'm extra little scared now. Thank you very much. I thought I was the most paranoid person on the planet, but apparently I have more room to grow.
Well, yeah. So it used to be everything was claims centric. And so people would just buy claims data, and it was structured, easy to interpret. And so now, instead of just a claims focused data set, it's trying to be patient centric. So it's like the patient is the center of all the different insights. And then what data can we buy around the patient to complete this holistic profile? And so, it is a little scary, but I will say that HHS and other state agencies are actually starting to put more of their weight behind penalties of
Good.
improper use of data. And this is also where Integral is sort of like riding the coattails of that tokenization breakthrough that I mentioned about like linkability that is encouraging more purchase behavior, but also these like civil penalties being higher means that the downside risk is higher and people are willing to make sure that they've got their ducks in a row. And that's where Integral comes in and kind of helps people navigate that framework.
So I'm still stuck on this joining of data. So because it's tokenized and it's not Rafal Los bought 16 pounds of steak and a bottle of bourbon going straight to my health insurance company because my doctor says, hey, eat less red meat and drink less, which is a funny meme in itself. But so you've got this tokenized data, which can be used for, I imagine, and tokenized data is really good for using in like research and kind of the expand at the social level rather than at the macro individual level, right? Is that what we're talking about?
Yeah, that's right. So research, anytime that you have to join multiple different data sources, right? If you're just trying to understand the efficiency of a healthcare system by itself, then tokenization isn't that important. But it's like if you're trying to get that holistic patient journey with multiple data sources, that's where tokenization is really helpful.
Well, we've been talking about helping America eat better, eat less junk, exercise more, and get health and do more preventative care and get healthier. So you're talking about being able to give these different data users the ability to track patterns of, I mean, effectively holistic patterns of life in healthcare. There's with great data comes great responsibility, but that's a lot of responsibility.
100%. And yeah, you're touching on something that's really important to a lot of Americans as they think about the role of insurance providers in America in general is, what about preventative care? And so, so there's this idea of fee for service, which is the majority of all healthcare insurers. And so when I go visit my doctor, he or she renders a service. I say I feel like I have cold symptoms. She writes down that I just have a cold and prescribes me cough medicine or whatever it is. And so that's some sort of claim that gets submitted to my insurer, and the provider is going to get some sort of reimbursement from that. Now, that's fine, but a lot of people point to that model as being broken because it doesn't actually encourage getting ahead of issues, right? And so diabetes and musculoskeletal issues are some of like the biggest expenditures in the economy. And it's like, what are we doing to actually prevent these people from seeing the doctor in the first place? Because right now the incentive is for the doctor to see me as many times as possible because it's this fee for service. And so one of the things that could flip the script on this is value-based care, right? And so instead of an insurance company paying my doctor every time she sees me, it's like maybe what they've been looking at is like populations of people that provider can cover, and then paying based off of that population size. And so if you imagine like a lump sum that gets paid to the provider up front, it wouldn't be up front, but imagine a lump sum. It's in their best interest to minimize the number of doctor visits at that point. It's like, what can I do to be preventative, to prevent these like big expenditures that may come down the line?
Wow, that's very interesting.
Yeah, and so like one of the biggest challenges though is how do you actually price that appropriately, right? It's really, really hard for an insurance company to say, some doctor in the Lower East Side of Manhattan technically has access to maybe 200 and some odd thousand patients in a given year. How do I accurately price, and compensate that doctor fairly? And so the activation of data and access to data is one of the hardest problems. But yeah, people are getting optimistic about value-based care becoming more and more popular over time.
I must admit, I do. There's always that part of me, the good guy on their shoulder, if you will, that likes the idea of improved healthcare, and using information and become more value-based or preventative, as opposed to just wait till I get sick or break a leg kind of thing. But at the same time, the other guy, the little devil over here is going, every time we try to do this as a society, the in person gets burned hard, right? So
Mm.
whether it be financial data, health data, or anything like that, it's just, or something happens, it almost creates like this digital victim. And since, people, you could argue for the most part, in the majority of cases, humans don't get harmed when something gets hacked, but it's just, there's a part of me that's like, man, it sounds great, but what can this be the system we create with security in mind on the way out the door before it gets, let's not wait till the horse is bolted to figure out how to go back and fix it. So if we're talking about changing the entire philosophies of the concept of human health, maybe we should learn from the last 3 decades of doing it, starting the wrong way from a cyber perspective. What are your thoughts on that?
Yeah, I mean, there's a lot to say. I would say that I'm not going to be an expert on how the entire insurance industry needs to be refactored in the United States. What I do want to be on the side of is supporting free data movement as much as possible, where people, the governance of data is well maintained and documented, and so people are less likely to abuse it. Some of the abuse is not actually intentional, right? It's not like people are looking to go do nefarious things with data. They just want to build richer and richer insights on their customers, patient populations. And, they might get in a situation where the fidelity of data is so high that now if there's a leak, people are going to be identified. And so, maybe there are other people on this pod that in the future that can speak more to the nuances of the insurance and payer system. But yeah, I'm said another way, I'm sort of like we're the middlemen in the middle that help you not break the law and like enable free data flow, right? And so, yeah, I mean, philosophically, I like the idea of a value-based care model, and I hope that we can support it. But if there's a better model, I'll support that too.
Can I slight pivot, because as you guys are talking about tokenizing and potentially anonymizing to a degree data, the applications for security, not just privacy, but for security become start shooting into focus. And specifically, I want to think about, how do we lower the value of stolen healthcare data to create a disincentive for attackers to spend a whole lot of time attacking and stealing this data? Because right now it's super valuable and everybody has it, right? It's everywhere. Everybody collects it. Every doctor's office, every hospital, every ambulance company, every follow-up, every prescriber, every pharmacy has so much real, identifiable personal data. How do we broadly decrease the value of that?
Yeah, it's an interesting question. I'm not sure if the framing of decreasing the value of it as like a bounty is the right approach. Maybe. I think you're touching on something, which is that if it's fully identified patient data, then that access to that data is a big bounty that people can, have ransomware attacks for. And this happens to hospitals all the time. It was a part of the Change Healthcare debacle last year that we can talk more about if your viewers might be interested. And so there are strategies for that, right? Encryption at rest is one. We can talk about homomorphic encryption, which is another huge advancement, which would be keeping the data always encrypted at rest and even in transit, but it enables functions on the data such that you can share it to an external server. It can act on the data, build some sort of model, and then return encrypted data back without ever actually reversing it back to plain text. And so there are mechanisms. I think inevitably there are going to be proper uses of data, right? You have to be able to see the patients. You have to be able to submit insurance claims. This is just required. And so people are looking at minimum access, minimum necessary access. So only the people in like a specific point in time are going to be able to have access to it. If you think about like for maybe some of the techies, some of the more fine-grained access IAM rules are things like GitHub's API, where you can actually say for this service at this time, I want these users only. And I think we could be moving more towards those models where people only have access for 30 minutes in a certain environment to ask a singular question about their patients. And like, what is it going to take to move towards that direction? And then finally, I'll say there's two halves of the house, right? So there's the fully identified data, and then there's the part that Integral focuses on, which is I'm actually de-identifying the data for some sort of data science research, some question, or I'm trying to commercialize the data, either for public research or selling to some sort of data retailer.
How much? Okay, I hear that. Now I'm curious. How much of this data broker, data retailer space is there? Like, how big is this? How many companies are out there buying my my grocery store data and trying to link that to my Fitbit data and then to how many times I go see my doctor?
It's much larger than you would probably think.
That's
and
not
so,
what I want to hear.
so I mean, look, the healthcare data in general in the United States is just, or the healthcare ecosystem in the United States is massive. So I think the number is $4.6 trillion in total. That's the segment of the economy that's American healthcare. Now, that's a really, really large, potentially misleading number because part of that is hospitals, insurers, biometric devices, orthopedic implants, everything up and down the chain. And then there's another part of that, which is the data ecosystem. And so hundreds of millions of dollars are spent every year on claims alone. But yeah, there's other data sets or alternative data sets that people are always trying to tap into, things like Fitbit. And then another thing I'll acknowledge too is we've been sort of speaking about structured data, but the next untapped gold mine that a lot of pharmaceutical companies are looking to leverage is that unstructured data. So radiology scans, clinical notes. During COVID, there were a ton of telemedicine visits. All of that is recorded and maintained somewhere, right? And so how do I activate those MP3s, those audio files, those transcripts in a way that is privacy safe, so I can start activating some clinical insights? Wow. And so the ecosystem of data is massive. You asked about players, Raf. I think your viewers would probably recognize names like IQVIA and Symphony. Those are some of the biggest retailers in the space. But there's even people like Komodo and Purple Lab that act as retailers and aggregators of data. And so there's a huge economy because people are just always trying to leverage insights on their data. They do want to have more accurate clinical outcomes. They don't want to spend a bunch of money on trials. Any pharmaceutical company that releases a drug to market, they want to make sure that it's distributed to the right patient populations, right? And that their ad spend is being used efficiently. And so there's a lot of different use cases, but yeah, it's a huge $100 million market.
Holy crap. I'm going to ask the question that I'm going to put myself, and my brain went into, as you were just talking, my brain went into, okay, so I'm a cybersecurity professional. I work at a doctor's office, a clinic with multiple doctors, a hospital network, something. So that means somebody is coming to my business and saying, hey, I'd like to buy your patient data. Does security get involved? Do you think security, or do you know if security teams get involved in those conversations, or what's that like? Because that if I'm a CISO in one of these organizations or director or whatever level they have, that's like a nightmare scenario for me.
Yeah, that's right. So it involves security, but it mostly involves legal, right? And so the very first question is, do I have a right to commercialize this data? And so when you go to your doctor's office and sign forms that say that, you're giving your information over to the provider, this and that, the first question is, what are the rights, attributed to that exchange? And so maybe some hospitals don't actually have the right to share or sell certain sensitive populations, their data. And so the first is that the legal question that has to be answered. And so if it is the case that you can commercialize data from patients under certain provisions, then yeah, the security team comes in next. And the biggest question is, can there be sort of a line of demarcation in an organization between the proper use of identified data that the doctors and the nurses are going to have access to, and that other side of the house, which is the de-identified data that is going to be sold to these purchasers. And so that's usually where the security comes in. And then I also mentioned earlier the tokenization strategy. That's sort of like the bridge between the two typically. And so that's where security comes in, making sure that there's a like clear sides of the house. And then you also want to make sure that the personnel are unique as well. You don't want somebody to be have one foot in both camps, right? Because theoretically somebody could remember who somebody is, even if it is on the other side de-identified. And so that's where security comes in, like separate VPCs, separate access controls, and then theoretically, if that is organized properly, you can commercialize anonymous data on the other side.
Okay. I mean, I feel a little bit better about this. I'm not crazy about this model, but I suspect that healthcare is probably, you know, not the only. I know that healthcare is not the only place it's happening, right? Your cell phone provider sells your location data. Everybody sells everything to create these models of people. John, it feels like privacy is not like. How do we even remotely say that privacy still exists when you look at the world today? Your phone tracks you, your car tracks you, your healthcare tracks you, your Fitbit tracks you, your watch, your like everything tracks you and tracks data about you, builds models, sells them to somebody whose interest it is to sell you more things, or use that data to figure out how to sell you more things, better things that you'll like. And in this case, maybe help treat you better, so that you're at the doctor less often. Like, are there opt-outs for this? Is that even a thing?
Yeah, certainly. So, I mean, when it comes to ads data on the internet, I mean, use Brave browser. I actually use Brave browser and couldn't join this podcast, Raf. I had to hurriedly download Chrome to be able to join this.
That's
yeah, like use a VPN, right? So there are certain things that smart consumers can do, but I also take an optimistic approach to this, right? I think that one, like I said, there's various 3-letter state agencies in the United States that have a huge incentive for protecting citizens from, the exposures that we talked about. And so there are stiff penalties, civil penalties too, that come with the improper use of data. And so I do think people are trying to go about it in an honest way. And the other thing too is that people have money, they're going to spend it. I'll sort of describe the pharmaceutical companies. My co-founder, Shub Sinha, loves to say that pharmaceutical companies are cash rich and data poor, which is completely true, right? And so most pharmaceutical companies specialize in clinical design, bringing drugs to market. Sometimes they're buying phase 2 drugs and bringing it all the way through stage 4. And they don't actually own any of the other data beyond just, manufacturing the drug. And so if I'm AbbVie and I sell Rimvoq or whatever it is, I know that I'm manufacturing and selling that in some capacity, but I actually don't know who's visiting a doctor when is that doctor writing a prescription for it. And then the pharmacies themselves that are fulfilling the prescription are a completely different set of data. And so they're running out and buying all of these different data resources and stitching them together to make sure that they know, what's happening on the ground, besides that just sort of like, bulk shipment of vaccines or whatever therapeutic. And so they have this data, they're going to try to activate it. I would rather be on the side of helping them spend their money more efficiently, such that the costs of everything come down, right? Part of the reason that everything is so expensive in healthcare is because it's so inefficient, right? And so part of the inefficiency is the free access of data. And so, Integral's on the side of helping people anonymize data, play within the right regulatory frameworks, actually get a magnifying glass on what the risk profile is, such that, like I said, data can flow more freely. And I think the complexity of the healthcare ecosystem is the reason for a lot of the cost. And so my sort of optimistic hope is that more data, easier accessibility brings cost of everything down, because there's more efficiencies that are introduced.
One quick question to follow up to that point is, do you ever see a world, or do you even see it being possible to anonymize / tokenize data at the point of collection, so that the actual human feels like they're being protected, as opposed to just throwing it in the system and hoping that happens?
Yeah, absolutely. There's a lot of different approaches that, tokenize as soon as the data is collected. There's various projects too that will well, I'll sort of say, try to give power to individuals so that they can have more agency over their data. And so I guess I'll take a step back and acknowledge that there is the provider-patient relationship, and so the provider's acting as a covered entity. But there's also patient consented data, right? And so if somebody comes to me and says, maybe it's more interesting if I have a rare disease or an orphan disease. But if somebody comes to me and says, like, I'd like to, leverage your data, I can say, sign on a dotted line and say, you can use my data however much you want. And so there's a lot of companies that are kind of developing around the idea of patient consented data with the hopes that these patients can actually be fairly compensated for the data that they're sharing out, right? And so, but the challenge is that a lot of these companies that are buyers are only really interested if it's millions of lives, like millions of patients. And so you need to get, when it takes a village, right? You would have to bring all your friends, all your family together and sort of like to have the proper payout. But yeah, and then I would also say the crypto community, not that I'm an expert on anything there, is more interested in like the agency of your data and making sure that you own that data, and then like you can track everywhere that it's going. And so there's some maybe potentially exciting opportunities there. But yeah, people are more interested in maintaining their data.
John, you kind of hinted at so you're over at Integral. Tell me just very briefly, because now I'm interested. What's the thing that, like, what makes you guys unique? Because what makes the company unique? What in the way that you do the thing that you do?
Yeah, absolutely. So I'll try to be brief with this. So my co-founder is the one who had the market insight initially. So we've been working on the company for almost 4 years now, but he was at a large data retailer and he was trying to help activate insights for the big retailers of the world like Kellogg and Walmart and some of these others. And then when trying to support healthcare companies, life science companies, it was very, very difficult because of all the privacy regulations. And so the way this happens today actually is that a lot of these companies will hire consultancies, so like the McKinseys of the world, right, and have them write a report to make sure that they're not breaking the federal HIPAA standard. And this usually takes 3 months and is super painful. And on the other side, your data is completely gutted, like nothing remains. It's just the sort of the most conservative approach because they don't want to risk anything. And so that was really, really painful. And so Shub and I got together and said, let's actually just have a technology first approach to this. And so the way that we've implemented this is building data pipelines with a privacy model baked in, right? And so instead of something that's kind of bolted on as an afterthought, this compliance module, it's becoming a foundational layer for us, in which case you can build a lot of really interesting things on top of that technology stack. And so the thing that differentiates us, I mentioned one, which is like the time to value, right? So a lot of our customers are getting these data workflows anonymized and certified in a matter of days rather than 3 months, because we're just letting the algorithm deterministically tell us what the risk profile of data is, rather than a consultant trying to by hand score all these things and it just taking a really long time. And then one more thing, Raf, that differentiates us too is we're not the only people that anonymize data in like the healthcare ecosystem, and I won't pretend that we are. But we are unique in that we are, as far as I know, the only provider that will anonymize unstructured data and then certify it as well. And so the certification part is a final thought before I let you jump in. The certification is interesting because we're taking on the liability of saying that it meets a certain compliance standard. And if we're wrong, we have to pay for it. And so we not only say this is safe, we're taking on the liability. And so a lot of our customers are like using us almost as like an insurance policy. And so we will anonymize unstructured data, take on the liability of saying it's anonymized, and then all of our customers are now confident that they can tell their data science teams to just rip and ship and build models on the things that we've anonymized.
So does that mean that at some point you had to go through like HHS and have them validate your algorithm or your the way you guys score and all that stuff, so that like you have some confidence in that?
Great question. So I'll do some name dropping, but no, there's not like a standardized HHS test to say that you've understood the HIPAA policy sufficiently well. I think this is akin to like an expert witness in law. And so,
Okay.
Getting invited to the stand as an expert witness to weigh in, so long as you can justify that you have sufficient experience in the industry and that you've worked with this type of data before, then you can be considered an expert determiner, right? And so, like I said, it's kind of like, as long as you can justify it, and I think we have one of the best justifications because we're actually working with, like I said, I was going to drop some names, Dr. Brad Malin, who helped co-author HIPAA in the 90s. And so he's like one of the most well-respected people in the privacy space. He heard about what Shub and I were doing at the beginning, and he's like, wow, this like should exist. Let me help you. And so he comes with a ton. Yeah, he comes with a lot of experience. And we have other privacy advisors that work with us as well. But to be able to attach our name to sort of like the core technology that we've developed in-house is super, super important for that defensibility.
Cool. All right. Well, I'm out of things to talk about. I mean, we could. Well, that's not true. We could talk for an hour. I think this is a good place to end it. This is an interesting space. I think we should probably, Jim. I think this feels like we should dive into this more often, at least
100%.
deeper in some of these other aspects of it, because there is still this looming black cloud over my head about marrying. Like I understand the desire and ultimately the need to understand what a population consumes, how active it is, what it does, what good behaviors it has, what bad behaviors it has, etc., and how it relates to like that population's health. But hot damn, does that freak me out?
Yeah, I mean, do you want to be paid or charged fairly for your health insurance? I mean, right now everybody's just kind of averaged out to include some of those more expensive patient populations. Yeah. But like, if you're making healthy decisions, like I wish my premiums were lower and more accurate to what I'm actually going to be, charging my payers.
Oh man. Okay, maybe that wasn't the final thought. One more thing then. So are you? Cause this is the first time we said it. So are we pushing potentially towards a world where, like with life insurance, somebody looks at like, hey, do you skydive often? Are you somebody that has dangerous, like verifiably dangerous lifestyle? And if so, your premium is going to be a little bit higher than the person that like has an average lifestyle and not as high as the person who doesn't ever get up off their couch.
Yeah, I mean, look, there's some considerations that our federal government has around protecting against some of those initiatives, because then what you can do is just sort of like become an insurance company that only covers healthy individuals, right? And so like our federal government doesn't want that sort of negative incentive. But certainly it is true that if you are healthier, you should be able to have a smaller premium every month within the population that's in your employer or anything else. And so, but that's only possible if data flows more freely, and people can only use the data if they're confident that's been fully anonymized. And so, yep, as a final sort of like shout out to Integral, that's what we help with, just getting a view into what the risk of a set of data are. And so, yeah, thanks for having me on, Raf and Jim.
Yeah, appreciate you, John. That's good insight. That's an interesting type of company. We've never had this conversation. I'm glad we got a chance. It's a worthy endeavor, and like it exists on the credit card side, it exists other places. I suppose it needed to exist in healthcare. If you've got the backing of anytime you have the backing of somebody that like wrote the original. Like I remember working with James Christian Hansen. You're like, yeah, that guy wrote the PCI DSS. I'm pretty sure having him on the team would be a good idea. So that's awesome. Thanks for taking your time. I appreciate it. I know 45 minutes in your day isn't the easiest thing to find when you're trying to build a company, but appreciate you, Jim. Really insightful. This has been really insightful.
Yeah. Thanks for having me on. This was fun on my end. I'm glad to share some knowledge and wisdom for your listeners, and hopefully it inspired them to think a little bit more about what happens when they go and see their doctor.
Yeah, I'll post some links, John. If you've got anything interesting that you're reading that might be good for the listeners to go, like things to just go read up more on. I think that I'll post some links. I'll post a link to Integral too, because I think it's an interesting company, and we'll further this conversation at some point, folks. Thank you so much for listening. for having us in your ears while you're doing chores, going off for a run, a healthy alternative to sitting on the couch, or whatever it is that you do. So we'll talk to you guys another time, another place on yet another Down the Security Rabbit Hole podcast soon. We'll talk to you later. Bye-bye.